Right, to answer all our questions on India's battle and the world's battle against coronavirus, we are now being joined by World Health Organization's spokesperson, Tarik Jasarevic, live from Geneva. And Tarik, I'd like to welcome you and thanks for talking to WION. Now, what's the sense as far as the World Health Organization is concerned? Cases are coming down in China and South Korea, but cases are spiking in Europe and the United States. So what's the status of this pandemic? Are we getting it under control or losing this battle against COVID-19?
Well, you have put it already very well. We see in some countries that measures that have been put in place are giving some results. But we have seen in other countries that number of people getting sick is increasing, and health facilities and health systems are being put under tremendous strain. We do expect to see more people being infected, and we are renewing the call that we have been trying really to send out for 2 months now, and that's all countries need to step up the preparedness. They need to ensure the health systems are being provided with what they need, that this has to be all of the government approach, and that population has to also play its part. It is possible to contain this disease. It has been shown, but many countries have to go into mitigation measures as well. So the blended approach is needed, and we hope that the population around the world will work with their governments and follow the advice.
Absolutely. The advice of the World Health Organization and the health officials, their advice must be adhered to if the world at large has to beat this coronavirus pandemic. Coming to India, now India is a country of 1 billion plus people. It's the second most populous country in the world. It's a neighbor of China. So far, India has only about 160 cases of COVID-19. Would the World Health Organization praise India's efforts in battling this coronavirus?
Well, when I was talking to my regional colleagues, they explained me that India did preparedness work in order to enhance laboratory capacity, in order to train health workers. So exactly what WHO was asking all countries to do. We are really trying to say to all countries, look at your own situation. It's not the same thing if you have thousands of people already in hospitals and it is difficult to know where the virus is, or if you just have a small number of cases where you can still do containment measures. When we talk about containment measures, it is basically trying to see where the virus is, to identify people who are sick, isolate them, provide them with the medical care, test them, of course, and look into people who have been in close contacts with them. So if we try to go after the virus, try to isolate the virus, then we can talk about containing the disease. Unfortunately, if we get to the situation where we don't know any longer where the virus is because it's widespread in a community, then the only option may be really the social distancing, physical distancing, avoiding mass gatherings, and what we have seen right now, what we are seeing in a number of countries right now. But everything has to be done, especially by countries that are at the beginning of the outbreak, to try to contain. We have seen that what China, South Korea, or Singapore have done, that strong measures that obviously bring some disruption to social life, but have a huge public health benefit in terms of getting really the virus isolated, that we see that this strategy can work.
Now, China, Italy, South Korea are all taking drastic measures because the instances of COVID-19 cases exploded in those countries, so drastic measures were required. So far, India is not in stage 3. Would you praise India for taking steps at the initial stage in keeping the numbers of infected people down? And what should be India's major steps now to prevent stage 3, that is community transfer? Because India's health ministry says there is no community transfer in the country as of now.
Well, I think this is exactly what I've been just saying. It is do the containment. Really try to look where the virus is, isolate people who are carrying the virus and those who may have been at risk of being exposed, so close contacts. By those measures, we are sort of isolating only people who are at risk, and we are not isolating everyone from everyone when it comes to physical distancing or avoiding mass gatherings. So I think every country who has still relatively small number of people who are sick should go into very strong measures to try to contain it and try to basically remove the risk for healthy people to get infected. Unfortunately, we see in many other countries that it is getting more difficult to do that, and that other measures are unfortunately necessary, such as cancelling mass gatherings, doing a very strong disruption of the social life, trying to keep people away one from other, and that's obviously something that can slow down, but will not stop the spread.
Right. One final question. Prime Minister Modi has initiated a SAARC movement, a joint battle plan of all the SAARC nations to combat the virus. He's also called for a virtual G20 meet. Do you believe such global effort is required to combat this COVID-19 crisis?
We have been very consistent in saying that what we need right now is a solidarity. We don't need pointing fingers. We don't need blaming anyone. We don't need stigmatizing any nation or any group of people. This virus is attacking everyone and is a common enemy. So any regional or international cooperation is welcome. Countries should learn one from another. Countries who have this outbreak for a longer time can pass the experience to others who are just starting to have it. We need to look at how we can help countries with the weaker health systems. WHO has been working for weeks now trying to identify gaps in countries with a weaker health system to see how we can help them. But that country can be done in bilateral way as well. Regional corporations should be activated. So any form of solidarity is a positive thing. And any sort of cooperation between countries can be helpful because we are all together in this. There is no one who is outside of this battle right now.
Right. One final question, short question, before I have to let you go. It's been a few months now that the world is facing COVID-19 crisis. Do we have any clarity as per the origin of the coronavirus, and as far as the treatment is concerned, are we closer to a vaccine?
So regarding the source, it's likely that it is in a population of bats, but we still don't know how it went to the human population, whether there was an intermediate animal that transmitted it to humans. This is something that is being looked at right now, because most of coronaviruses are really circulating in animal world and then occasionally jump to the human population. When it comes to treatment, we announced yesterday that we will start trials on different drugs that already exist. So these are not new drugs, but drugs that have been used for other diseases to see if they can be efficient in any way for COVID-19. So there will be trials that will start in a number of countries. So hopefully this will give us some results at some point. When it comes to vaccines, there are also a number of candidate vaccines, but as you know, both vaccines and medicines have to go through rigorous scientific process of trials, and then at some point we would need to look into mass production. So we are working on that. There is a parallel track on research and development,
right.
But it will take time, and we will, in the time being, we need to focus on what we can do now.
Right, Mr. Tarik, thank you so much for joining us. World Health Organization sharing his views on how India can avoid stage 3 of the coronavirus.